Please take your seats. We can start. The last panel, not least important, on the contrary, panel covering topics that we are facing on a daily basis. All the citizens of the country are facing them on a daily basis. The history showed that with each pandemic we have crisis and economic changes. The consequences of the COVID-19 pandemics caused health crisis, economic crisis, additionally the war crisis that is in front of Europe is giving us opportunities to find solutions for the challenges, especially for the most valuable categories of citizens. The government of the Republic of North Macedonia adopted a number of crisis measures in order to improve the situation for its citizens. The main topics, you have heard them before the break, that we are going to deal with in this panel are the anti-crisis measures, the vulnerable categories, increase of the average salaries, improvement of the social, children, and health protection, rights of the people with disabilities, international classification, and the possibilities for the people with disabilities, and the health policies. The topic of social and health policy will be covered by Mr. Bekim Sali, Minister of Health, Ms. Jovana Trenčevska, Minister of Social Policy, Mr. Massimiliano Pucci, Director of World Bank in Macedonia, Rosana Duciak, representative of the EU in the Republic of North Macedonia, Ms. Ana Daneva Markova, Counselor of the Prime Minister of the government, and Ms. Stanka Trajkova, President of the Association of Pensioners of the Republic of North Macedonia. We will start with Minister of Health, Mr. Bekim Sali. We have finished the previous panel in this direction. We finished with digitalization, symbolic announcement of ADA, the digital assistant, online assistant for implementation of the activities of the government of the Republic of North Macedonia, and digitalization in the health area, which will be very important. How much the digitalization can contribute towards improvement of the health system? The Minister of Health will discuss about this, and he will also discuss the primary health protection, which is the one of the top priorities of the government and the Ministry of Health, and are part of the strategy of the Ministry of Health for 21-30 period. What I have mentioned, the focus of the ministry is put on digitalization, what is the future of the health system, and modernization of the health system with new equipment. We will discuss in that direction what projects and investments were implemented so far and the government is planning to implement in the next year that just started. Thank you. Dear panelists, distinguished guests present here today, you have mentioned that we finished the last panel with digitalization with ADA. We're starting with digitalization in the health system in this panel, digitalization in the health system, and connection of information connection of all the levels of the health systems are the future of all health systems. Namely, the Ministry of Health is developing the digitalization process in two directions. This is a need for all the citizens in the country. One of the directions is digitalization systems and platforms for the citizens, and the other one is alleviation of the diagnostic system. early diagnostic system for the patients. In the part of digitalization, for informing and connecting the health levels, the health level protection, we are in a final phase and we're intensively working on this. We were intensively working on this in the last year. This is the portal and the platform My Health, which is going to be a mobile application that the citizens are going to be able to install on their devices, on their mobile devices, on their mobile phones, and thus have access to their information, the health information, personal data. This is based on the national system My Termin, which contains all the necessary data and information regarding the analysis and directing from one level to another level in the health system. The national portal for electronic health system is in the final phase of development, and it will be soon be promoted to the public. The access to this portal is going to be through health.mk, and it is going to enable access to information for all the citizens regarding the programs for immunization, screening, and other useful data and information for the citizens. Of course, the database for this application is here as well. This is the MyTerm database, which was developed and is present in our country for some period now. Each year we have new modules which are easing the work of the health workers. As I have already mentioned, each year this system is upgraded and perfected. So far we have digitalized several processes in the health system. The carrying out of a screening process for early detection of ovarian cancer, which enables the women to be referred from their GP, and they will have the results in electronic form, which enables us to follow the data and information on each of them, since there are alarming information for certain areas in the country and the system needs to take action in these areas. Last year in electronic form, we also had the calendar of immunization and immunization for the seasonal flu, which was carried out through the web portal vaccination.mk. I have to mention that 2022 was a very successful year regarding the immunization for the seasonal flu, knowing that in about 20 days we have recruited more than 48,000 people, citizens from our country. Therefore, I consider this the most successful year regarding the vaccination for the seasonal flu. This portal is also used for the regular calendar immunization of the citizens. I see that the timeline is done. Can I say some more with regards to the other platform that we are developing? We need to stick to the timeline. The equipment for digitalization was supported by the World Bank with finances. This was a very good activity we had last year, and we expect that this year this equipment will be put into function. We're talking about digitalization of apparatus, of equipment used in early detection, early diagnostics, and they're distributed in 14 public health institutions. 5 of them are university clinics, the 3 clinical hospitals in the country, 5 general hospitals, and 1 specialized hospital. They will be equipped with the most modern diagnostical equipment. In the interest of the time, I'm not going to go more into details. Accelerator in the hospital 8th of September, the radiology and oncology equipment in the clinic, and other tomography equipment. I'm not going to go into detail in the interest of the time. Thank you. Just to explain briefly to those who joined us later, each of the panelists have time of 4 minutes to speak about their topic. If any of you cannot cover the addressing in 4 minutes, we can have this opportunity later on when we go back to the same person, to the same panelist. Thank you, Minister, for the information you shared with us. This is very encouraging for the health system in the country and the access to the public services, public health services. Another ministry that is covering really large number of citizens and have a very important role is the Ministry of Labor and Social Policy. In this part, speaking about the results of the ministry, we are going to hear the addressing of the Minister Jovanka Trenčevska. This is one of the most responsible ones, the rights of the children, the pensioners, the workers, the fighters. These are the categories that are covered by this ministry. This means a lot of work, a lot of labor towards improving the lives of the citizens. Except for what has been done in last year, we will discuss what are the plans for this year, 2023, and what will be the benefit for the citizens. We are going to hear the addressing of the Minister Trenčevska. Thank you.
Thank you. It is a great challenge to be a Minister of Labor and Social Policy and to create policies that improve the life of citizens, especially taking into consideration that we found ourselves in economic and energy crisis, and how in such conditions we should secure social safety of each citizen that requires support from the Ministry of Labor and Social Policy. I will try, as much as the time allows us, to briefly present the results through well-created policies and measures in 2022 that truly yielded results, not only on short term, but will give results in mid and long term. We started the year with implementation of the legal solution. Sunday, non-working day, day for rest, day that we will devote to ourselves, to our family and friends, and for all those who, due to the nature of their work, cannot stop the process of working, and those who continue working on Sunday will receive 50% higher per diem in production and 100% more per diem in trade. This solution stirred positive reactions, especially among the workers, and after 1 year of implementation of this solution, we already feel the results and the pleasure of all those to whom the amendments of the law on employment referred to. Furthermore, we amended the law on minimum salary by defining the minimum salary at 18,000 dinars. Now we have 2 times more from the minimal salary in 2007 when the Social Democratic Union came into power. What is most important, we established a system that will mean continuous growth of the minimum salary that will not depend on the political will of the government nor on the Minister of Labor and Social Policy, but simply we have a system that will mean continuous growth of salaries. So in March this year, we expect that the new minimum salary will grow by 2,000 dinars and will be more than 20,000 dinars. Furthermore, as a target group that is of our great priority, of course, are the retirees. So we made the amendments to the law on pension and disability insurance, and we introduced new methodology. We introduced a system that means continuous rise of the pensions and the harmonization 2 times a year pursuant to the growth of costs of life and the growth of the average salary. Even in terms when we will not have so great inflation as it is, and average salary and pensions will grow, we expect that in March the pensions will be higher by 5%, and in less than a year, in 12 months, the pensions were increased by 16%. This hasn't happened so far. And in 2023, in September, we'll have another harmonization of the pensions, and the pensions will grow 20% in 1 year and 6 months. This has never happened before. Besides the systemic solutions regarding the minimal salary and the pensions, we also adopted 2 packages of anti-crisis measures. The first one included all 330,000 retirees with financial support of about 3,000 dinars and all recipients of the guaranteed assistance of 1,000 dinars for 3 months. All those beneficiaries of this assistance in the period from October till March additionally will receive 1,000 dinars so that they can tackle the price of the energy for the ongoing season. We're implementing the second package of anti-crisis measures that were adopted by mapping the most vulnerable ones, those who mostly need the financial support at that moment. Those are the people with disability at the age above 26, the children up to 26 years of age, the parents recipients of guaranteed assistance, the citizens who have serious health problems and have the right to care from a third party and have permanent diagnosis to exercise this right. Retirees who receive pensions up to 14,000 dinars, as well as those workers who exercise the right to using compensation for material security. In January, February, and March 2023, all these categories of citizens, all these beneficiaries of social and child care protection will have monetary compensation and additional financial support depending on the target group. We increased the child protection compensation for children with disability, and we are harmonizing this with the cost of life. This will be higher by 14.2%, and this means that children with disability, recipients of this special compensation, will have greater compensation of about 30%. Truly, these systemic solutions give results, and that is why our government is focused at not populist measures, but solutions that give results in short and long term. Regarding the social policy, children protection, there is a lot to speak about, but I will try to add more in the second set of questions. Yes, the Minister of Economy mentioned the strategic planning as one of the top priorities opposed to the campaign and populist solution of the problems. So this was also said by you. You also mentioned the inclusion as part of the academic community, and I'm glad that all strategic documents have wide participation and inclusiveness, and the academic community has the opportunity, but also all stakeholders, to provide their contribution. I'm sure that you will have numerous public debates to defend what steered reactions, and that is the draft law on the system for salaries in the public sector, law on people with disability, and other laws and bylaws arising from these solutions. We return to health. The minister mentioned that the improvement of the public health is a strategic priority of the government of North Macedonia, and the objective is to provide approach to quality and available health services and approach to medicines. And regarding this question about the improvement of the health of all citizens, we'll speak with Anna Daneva-Markova, professor in a triple role as part of the academic community, as advisor to the president of the government, but also as a doctor practitioner. So she can cover this from three aspects. Thank you.
Yes, the minister has nicely put it. The fact that this is panel 4, healthcare and other social welfare topics, doesn't mean that this is less important. Unfortunately, we cannot speak fast. We can see the attendance in the room is really great, and I thank all the partners that we cooperate with that are attending. Certainly, strategic priority is the promotion of public health in the past 2 years, especially the challenge with COVID-19 pandemic faced us with the conclusion that at such points and other moments, public health is the one that should help the system, although the process of investment as a mechanism to improve healthcare mentioned by the minister and the president should be a continuous process. The investment in health equipment, infrastructural modernization of facilities should be a continuous process, and even more should be invested to be able to be faced with the challenges coming to us. What has been done in the brief period mentioned was to promote the process for refunding of drugs, which is a major challenge for all stakeholders, led by the Minister of Health, together with the other important stakeholders, key stakeholders in the process. As to the healthcare, patients, organizations, and the pharmaceutical industry were the stakeholders for the first time ever in an inclusive manner, in an open discussion and communication within a relatively short period. A final solution was reached, or deep blockaging of the process that would mean a lot, primarily for the patients and the system as a whole, since it enabled budgeting, then predictability for the patient, continuous presence of certain drugs and medications, and primarily the new innovative biological mechanism of modernization that has been used by the system to procure the medications for the first time, some of them in 2018. And I hope that this process of modernization will continue in the future towards primarily of providing the challenge of the physician to prescribe the therapy that would be most beneficial for the patient. I cannot forget to mention the current brain drain challenge in the medical profession, which is a topic, but I wouldn't see that as a problem. This brain drain, this migration could be in the future, directing us towards new strategies, towards implementing new methods and introduction of experts from other countries, such that this current brain drain of our staff to be prevented, because not only the system of payment of young physicians that was introduced for the first time 4 years ago is an insufficient stimulus or motivation to retain them. It would be much more important, as was done in the previous period, to retain young people and secure accessibility, good quality health care service, not only at the tertiary level, but even more in the coming period, hopefully through kind of regionalization of all the other health facilities. Yes, you mentioned this brain drain of medical staff, but also inaccessibility of social and medical services sometimes encourages our citizens to leave the country and find the resources they need and the support from the system. I'm glad that I can hear that human potential is also considered at all levels. Let us go back to social welfare, introduction of social reforms. The last social protection law of 2019 meant support for more than 30,000 households to leave poverty. For the first time, the minimum guaranteed income was introduced and social assistance was increased by 300%, but in spite of investment in the rights of social and child protection, social services were also invested in parallel. The decision of the government that every citizen is equally important and that everybody has the right to equal opportunities is confirmed in action with co-support of the World Bank. Social welfare services are being developed at the local level, making them accessible to every citizen regardless of their place of living, be it a rural or urban area. Then investments are made in children, inclusive kindergartens following worldwide centers are constructed, and new children are introduced in preschool education. Regarding all of these issues and the World Bank support will be discussed by the World Bank director in the country, Mr. Maximiliano Paolucci. You may take the floor.
And good afternoon, Madam Minister, Mr. Minister, distinguished members of the panel, and distinguished audience. So indeed, you pointed out to one important, let's say, trigger of the improvement of social services, which is the approval of the law in 2019, which is actually something that I will also touch upon in my subsequent intervention, because that particular law is the law that helped the country weather the conditions and the impact of the COVID crisis. Because by having a well-targeted system to support the poorest, the most vulnerable, this country was able actually to support those that were most in need during the crisis. That said, the social service implementation, the social services improvement project that we are implementing with the Ministry of Social and Labor is an important one, because it builds on this aspect of supporting those who are most in need and the most vulnerable, but it also changes the philosophy and the modus operandi of the Ministry of Social and Labor in the delivery of social services, because the ministry is basically now setting standards, focusing on quality, making sure that the coverage is uniform at the national level, whereas the actual delivery of the services is delegated to private providers. What is the innovative part of this? The innovative part of this is that the ministry is now working through a rule book to define the interventions that can be delivered, but also is also working at the licensing part to make sure that these services are delivered with the highest standards of quality and performance. So since the establishment of this rule book, I can see that more than 700 beneficiaries have been reached out through 22 providers for more than 33,000 hours of services delivered. I myself visited one of these remote villages were mostly inhabited by old people, because their children are now living in Germany and Italy, and I could see how these kind of interventions guarantees not only access to services, but a dignified life for people. Now, the important aspect of this intervention is that the ministry has really invested in it and has decided to continue by putting their own resources to support the implementation of this scheme. Now, the second part that you mentioned is that we support through this project is support to early childhood development. And the basis of this is that if you consider a child that is born today, at the age of 18, this child will be 56% productive, as if it were to have access to full education services, full quality education services, health, and social protection. The government has understood this very clearly and has worked at the national strategy for human capital development. And one of the pillars is early childhood education, because by investing $1 today, €1 today in early childhood education, the return for that particular child and for the country can go up to $16. So what has this project done? It has increased access by renovating, repurposing existing primary schools into areas for early childhood development. It has built up to new facilities for up to 2,000 slots for children, but it also has invested in quality. So access is important, but quality is an essential part of it. So I think that we are very proud of this project, because it's an innovative project that can deliver to citizens in a very direct way. Thank you.
Ви благодарам. Драго ми е што се осврнавте на два.
Thank you very much for addressing two very important aspects: early childhood development, where the World Bank provides support in a number of projects, then strengthening the educational components in kindergartens, in primary schools, and child education, and strengthening the competencies in terms of the educational component that was a bit neglected on account of the upbringing component, and child inclusion that was neglected on account of inclusive primary education. Now we are more working on early intervention and early involvement of children with disabilities and development difficulties in kindergartens. And then inclusivity of our society and inclusion of our society. We'll move on with our next panelists. International organizations provide strong support to the commitment of the government for inclusive society, equal society for all, equal opportunities. The deinstitutionalization process has turned out to be successful. It started 2003, however, through strong commitment and gradual preparation of both the local governments and communities, and strengthening civil society organizations through the support of international organizations, it has been increasingly going strong in terms of resources offered by the state. In this regard, the support for inclusive society and inclusion of people with disabilities covered by the deinstitutionalization system and provision of best conditions to return to their communities, and including persons with disabilities as equal in the communities where we live, as well as the contribution of international organizations, will be discussed by Rosana Duđiak, a coordinator of the international organizations, that is to say the United Nations organizations in our country. You may take the floor.
Dear ministers, dear partners and colleagues, good afternoon. In the past few years, we have jointly accomplished significant results that we should celebrate. In 2021, the UN family started the implementation of the 5-year Sustainable Development Cooperation Framework that was designed jointly with our partners. Unfortunately, this occurred in the middle of multiple crises. The decade of action, in which we were supposed to provide a final boost for the 2030 agenda, started with the COVID-19 pandemic and continued with more crises that hits the vulnerable disproportionately. The UN system puts people at the center of all interventions. The principle of leave no one behind represents the commitment of all UN member states to focus on the most vulnerable. It's about the people, just as the logo of North Macedonia's presidency for the OSCE reads. As the moderator mentioned, many efforts were invested in facilitating the inclusion of persons with disabilities. We are particularly proud of partnering with the government in the implementation of the National Deinstitutionalization Strategy. Today, there are no children in institutions. All 180 children, of which 20 had disabilities, live in foster families or small group homes. Many adults with disabilities are living outside of institutions independently or with community support services. Several UN entities have invested their expertise to support disability-inclusive services in social protection, education, employment, accessibility, support to victims of gender-based violence, and participation of persons with disabilities in policy and decision-making. In addition, the UN system has been cooperating with the authorities to enhance capacity of the social service workforce on child protection based on the new foster kinship care standards and by applying the method of integrated case management. We have also been supporting economic opportunities by enhancing skills and employability and providing activation support for vulnerable groups, especially women and youth. We assisted the Ministry of Labor and Social Policy to design and implement 2 new measures in the care economy, creating a network of skilled and qualified caregivers available for persons in need in home care. Efforts to tackle youth inactivity and unemployment through innovative youth employment policy framework was critical, since the employment outcomes of young Macedonians, although improving, are still lower than European peers. The concept of young people not in employment, education, or training has been gaining ground as a tool for better gauging the labor market challenges of young people. Since 2018, when the Youth Guarantee was piloted in the country with UN support, more than 70,000 young people were registered and almost 40% of them received either an offer of employment, continued education or training, or a traineeship. This contributed to the decline of people that are not in employment, education, or training in the country by almost 6%, and even more in reducing the number of young unemployed. We have been working together with the government with the generous support of our donors and partners to analyze and address the socioeconomic impact of the crises with effective measures that will assist people and families, particularly the most vulnerable. With the support of the Joint SDG Fund, UN agencies have commissioned a comprehensive analysis to support authorities in addressing the challenges in energy, food security, and social protection. This dives deeper into the impact of the crisis on the most vulnerable groups. The detailed recommendations will be issued soon, but what is clear is that the policy measures to address the crisis need to be systemic, sustainable, and visionary. Despite challenges, we remain focused on sustainable development and the need to be well targeted to ensure the best possible results with the limited resources available.
Ви благодарам и прва од панелистите која што
The first of the panelists that stayed within the 5 minutes, I thank you for speaking on all the UN agencies in the country. You briefly spoke about all the processes, support, and projects where everybody is involved from their aspect of action, because the UN organizations have been involved in strengthening parenting competencies, strengthening families, supporting the families, and all the processes up until employment of all persons, their economic independence, and valuing and evaluation and valorization of their efforts and labor. One more panelist in this first round of questions. We also have Ms. Slavka Trajkova, President of the Union of Pensioners Association, that has been in place for more than 75 years, 55 civic associations covered, and 280 thousand pensioners involved. You've been actively involved in the creation of the new pension system. This is a point that you will dwell on most, I suppose, but we would like to hear from you about the important period from your life when pensioners have to have active and good quality life, relaxed period of their lives, and they should be offered opportunities to be able to present their creativity as everything that they couldn't do while they were serving their labor service, and to enable them to accomplish their desires. Dear attendees, on this occasion, I would say that the way it is organized and the way it operates for the pension system is very important, and it is of general interest for any country. Our retirement system, our pension system has been reformed, and it involved a capital component. The main features of a pension system are contained in our legal framework as well, including the goals. Then the stakeholders in the pension system, be it all the citizens or just the employed ones, then the entity that is making sure that funds enter the pension system, then the replacement rate, a very important element that identifies the value of work record, then insurance based on which the rights of the pension system are exercised, and also very important is the salary that is used as a basis to identify the level of the pension and index the pension, harmonizing them with the rest of the factors. In our pension system, all the employees have been involved, and under the latest data, the total number of pensioners is about 333,000 pensioners on all grounds, old age pension, disability and family pensions, and the average is 15,520 dinars, while the average level is 53.7%, which is the measurement of the value of any pension. And if it's less than 60%, this is alarming for the government to undertake certain activities to improve the ratio. Also, a very important factor in the pension system is the ratio between the insured person and pensioners. So how many insured persons will pay the contribution to fund a pension? Right now, this ratio is 1 to 2. So we have one latent positive movement of this ratio. What does this mean specifically? Two employed people would fund one pensioner, which is very positive because it is very well known that the main revenue for payment of pensions is the contribution. And it's very good for the pension system to have as many employed people as possible within trying to look for funds from outside. As to the latest methodology to harmonize the pensions, I would also say that the union, as the main representative body of pensioners, was involved in the a definition of the new way of harmonizing the pensions, and proposals by pensioners were embraced in terms of harmonizing the growth in salaries with the growth in salaries and cost of lives in equal percentages, of course. Thanks to this methodology, translated into the law on pension and disability insurance, pensions in 2022 were harmonized by 10%. Unlike the opinion of our minister, we are expecting that pensions at the beginning of this year would go up by about 8%. In this context, I would also say that the Union of Pensioners Associations of Macedonia as a civil society organization continued to observe the application of the new methodology and how it affects the levels of pensions and their payments. And we already have some new proposals that we submitted to government bodies covering two crucial issues. Primarily, the first proposal is for the pensions currently harmonized to be paid for all 12 months and overcome the issue of a possible discrepancies between the levels of pensions in the course of the year, calculated based on the same values in the previous year. As a civil society organization, we will do our best to formulate these two issues that we deem are fair and right proposals. And during the first modification of the law on pension and disability insurance, I believe they will be accepted. I also have to say in a few sentences that low pensions are also the focus of our union. As a civil society organization, we expect that pensions with low pensions will knock on our door. And we have to deal there with the issue why in our country, in Macedonia, we have so low pensions. And we came to a conclusion that low pensions are generated by the pension system itself. And the role of individuals is also very important, that is to say, of future pensioners. And on this occasion, I would appeal to the responsible institutions, primarily to the Ministry of Labour and Social Policy, to strengthen their campaign towards future pensioners, young people, to be aware of what salaries are used to pay their contributions, because their pension will depend on the basis upon which contribution is paid in accordance with the work record and the annuities that they would get from the private pension fund, that would also depend on the contribution paid and the yield generated. Let me wrap up here with the words that on the issue of low pensions, I believe will be debated. It's rather complex and I hope it will happen soon. And as to the young people, I would say, well, they're young. Insurees, workers think that old age is far away, but it comes quickly. Thank you.
Ви благодарам што на крајот поентиравте со тоа дека за
Thank you for concluding that for retirement and regarding the pension system, we should be well educated and we should prepare for this part of the life. After 73 years, a woman was elected president in this union. You have been active in creation of policies on your position. You had the opportunity to give comments on laws, and that is why you had this opportunity to reflect to all aspects of life as a retiree. We return to the Minister of Health. He lacked time to speak more about the activities. We know that primary health protection is the pillar of the public health. What is the Ministry of Health doing regarding the reformation of the healthcare protection so it can be more available and more efficient for the citizens of our country? Thank you. The universal health coverage means that people have right to health protection and health services no matter the time, and of course without any special financial implications. It involves full scope of health protection, starting from promotion of health, prevention, treatment, rehabilitation, and of course, palliative care. The universal health coverage should be based on strong primary health protection that is fully directed at people. The increase of the number of interventions in the primary health care, especially in countries with low and mean income, it means saving lives. According to some analysis, about 60 million lives could be saved if we increase the number of interventions in primary health care. And of course, the lifespan would be improved by 3.7 years by 2030. These are enormous and very interesting numbers showing the importance and significance of the primary health care. At the meeting on universal health coverage that took place in 2019 on UN high level, the countries agreed to increase the reforms in health protection, and the World Health Organization recommends adding 1% of the GDP for health care protection, no matter whether these funds come from the budget or from other sources. The government of the Republic of North Macedonia, with the support and in cooperation with the World Health Organization, started an ambitious project of reforming the primary health care protection by setting objectives to introduce digitalization into the healthcare system, to integrate services with other areas of healthcare system. This is the digitalization, connectivity between various levels, and to focus the approach towards servicing the communities and the patients instead of focusing on treatment of illnesses. This would mean focus on safeguarding the health, and in parallel, of course, to be ready for treating illnesses. The COVID-19 challenge postponed the introduction of these reforms in the primary health care, but at the same time, it pointed out how important these measures are for providing timely healthcare protection anywhere and at any time with the assistance of digitalization. During the COVID pandemics, we introduced the possibilities for video conference, communication, providing advice on telephone. We introduced the e-referrals and e-prescriptions that enabled to send patients and to prescribe medicines without the physical presence of the patient in the health institution. During this period, we identified the immediate priorities and key areas for enhancement of the primary health care protection following whether these could be implemented by assessing the legal regulations needed for implementation of the reforms. In 2022, we intensively worked with associations of doctors from the primary health care, and of course with the Chamber of Doctors, with the Chamber of Pharmacy. We worked on the law on healthcare protection. These are in final phase and will be soon in both the Assembly and the government for further discussion. E-scheduling of appointments in primary health care is underway, and Professor Danevom also mentioned that we worked on overcoming the obstacles regarding the rule book for adoption of a new positive list of medicines. We hope that the new generations will have these medicines. These medicines will be available to them, because we know that the gap of 12 years caused the patients to be treated with medicines of older generations. Adoption and implementation of clinical protocols for primary health care. We have adopted several protocols, and we expect that with the positive list of medicines, they will be put to function in the primary health care. Analysis of the administrative processes that are conducted by the doctors in the primary health care in coordination with the Fund for Health Insurance. And the idea is to reduce the administrative procedures, to introduce digitalization, and to alleviate these processes that take a lot of the doctor's time. We started this having a vision in mind, namely in the beginning of the 20th century, the average lifespan was 50 years, and now we have an average lifespan of 8 years, but these are so-called unhealthy years. And the objective is to improve the health, to safeguard the health, to protect the health, to be able to work. And of course, by improving the services in the healthcare protection system, we will be more functional. And when we discuss the retirement, the pension limit can move upwards if we as a country provide healthy nation. This should be seen in terms of finance and economy, and the overall well-being is the new GDP of each country. And of course, when negotiating with the Ministry of Finance for securing budget for the primary health care, one of the strongest arguments is this: the well-being of each citizen is the new GDP that imposes us to be more focused. And of course, we expect the support from finance to protect the health more and more. And of course, the other part on caring for patients and their treatments. Thank you. Thank you. I'm glad that you mentioned the mental health as part of the care for our citizens, including all aspects covered by this well-being and quality of life of the citizens at any age. We should, of course, take care of the well-being of all categories of citizens, even the oldest one, especially taking into consideration that lifespan is greater now, but our citizens should have quality life. The mental health is one of the priorities of your partnership with the Ministry of Labor and Social Policy, and many of the topics cannot be divided between the ministries. Both ministries work on these topics, many analyses, strategic documents. The strategy for family was prepared in joint cooperation. Both Ministry of Education and Ministry of Labor Social Policy provided their input. Early intervention, of course, that cannot be separated, because all our wishes and efforts are to become a social model and to offer resources in the area of health and social policies so that these can be more available to all our citizens. If we think about what we see as information on daily basis, the minister talked a lot regarding the rights to social and children protection, for capital investments for the youth, and legal solutions that contribute to the improvement of quality of life of all citizens. However, let me return to what I mentioned. If we see the information that we receive on a daily basis, we have great need from social services for vulnerable categories, something that we did not mention in the discussions, and of course the victims of domestic violence. What are the future plans in this new year that starts now? We'll hear from the Minister of Labor and Social Policy. Thank you. Yes, services that are close to the citizens, services that we did not manage in the reform on social protection for the urban and rural areas. Through the project of World Bank, improving the social conditions, in fact, the loan we use from World Bank is invested mostly in providing social services and preschool education. At this moment, we have 34 active projects in 43 municipalities. We are providing services in the homes of the citizens, depending on their needs, depending on the needs that were detected by the local self-governments. This is mostly assistance and care for elderly people and for people with disability. What is most important to mention is that following the support of the project within 18 months, the sustainability of this project will be secured by the government and the local self-government units, and management agreements are signed with the providers and the municipalities for continuation of these services and their approximation to the citizens. So far, we have signed over 20 management agreements in 2022 with civic organizations, with Red Cross, and with those who perform this service on a local level. We will continue doing so in future. When the projects will be completed and they will be part of the projections of the budget of the Ministry for Labor and Social Policy. What is important for the Republic of North Macedonia, beside the social services close to the citizens, is the process of deinstitutionalization. One of the practices we implemented in the past period. And in 2009, we started the reforms, and we are proud to say that there is no child with disability that is in an institution, and there is no child without parental care that is in an institution. They are placed in resident units with support of the community. In 2022, we opened 16 new residential units for support of life in community. We'll continue with this process in 2023. In March 2023, we'll start the reconstruction of the institution for rehabilitation of children and youth, supported by IPA project. This will turn into a modern rehabilitation center that will offer modern individual services to people and children with disability. We secured the funds through IPA in the amount of 1.4 million euros, and additionally, the budget of the Ministry of Labor and Social Policy has allocated funds for this purpose. When speaking of services on local level, I would like to mention the services regarding the victims of domestic violence, especially women. I'm proud to say that in all planning regions in the country, we have shelter centers for women who are victims of domestic violence. Furthermore, this includes their children. In all planning regions have provide advice for victims of domestic violence. But what is most important, all planning regions have provide services and advice for cooperation with those who with the perpetrators. We must work with the perpetrator, and that is why the social work centers and civil organizations support such services for work with the perpetrators of domestic violence. Thank you. The law on social protection offers opportunity for development of innovative forms of social protection, and I'm glad that all local communities are very active in developing these forms of improving the well-being of their citizens, especially those from the vulnerable categories who need additional and reinforced assistance. The minister mentioned one of the most important aspects for the assessment of the well-being and the lifespan. I will say that the rate of perinatal death rate show the situation in the health system in all countries.
As well as the accessibility of a network of relevant health institutions that secure the optimum levels of good quality care, will guarantee that every pregnant woman and every baby will get the best possible care during and after pregnancy and after giving birth. Professor Daneva Markova and a doctor at the Clinic of Gynecology and Obstetrics can speak very well on this topic. What are the indicators like regarding motherhood and newborn health in the Republic of North Macedonia? Thank you for the question. These indicators are vital indicators, and from the today's perspective, viewing the statistically realistic period where the reforms undertaken can be analyzed, we can say that we are happy with what we are seeing. Otherwise, as indicators regarding perinatal health, and through the perinatal health indicators, one assesses the health status in a country. That is to say, the benefit for the health of the mother and the newborn is not just a benefit for the individual and family, it is a benefit for society as a whole. 2016 might have been the most alarming year, and back then a concerning level of numbers was reached, and in 2019 at the highest possible level the need was recognized to reform the system. I wouldn't discuss the strategies undertaken and their titles. I would speak about results now, because we have statistically a realistic period within which we can analyze these reforms, if they've generated or not generated results, supported by UN agencies, UNFPA, World Health Organization, and complete experts in the area. A number of system reforms were introduced, whereby through standardized protocols and functional equipment of all maternity wards and additional staffing and training to improve their practical skills and effective analysis of all the data existing in the country without concealing and hiding the data we didn't wish to discuss in the past. A range of steps and activities and training events were organized, and nowadays we may say that even after the COVID pandemic period, we have stable trends, double reduction, perinatal mortality, and newborn mortality, and infant mortality, that is to say. So we need to follow this direction when the other panelists have mentioned. Europe is aging, our population is also aging, fertility is going down. It's an era of demographic resilience and movement of young people, and especially all of these strategies are important in terms of reproductive health. The law itself that placed our country in a green zone of countries that have the liberty in their reproductive rights, especially among women, speaks in favor of the fact that if the state, the government, the Ministry of Health invest in public health and in mother and newborn health, in all health policies, realistically, through the situational analysis and realistic consideration of facts, will give rise to the good trend continuing in terms of these indicators, and we can expect in the future that we will get closer to the challenge that we committed to accomplish those global sustainable development goals and the strategies of WHO in terms of improving mothers' and babies' health and adolescents' health, because only in this way can we influence their well-being. Thank you. Through all the discussions, COVID-19 pandemic was intertwined, and we are expecting eagerly for the WHO to declare that COVID-19 pandemic is ended, but the effects of the pandemic are still with us, and the challenges are remaining with us. And in this regard, we'll continue my discussion with the next panelist. We'll get back to Mr. Maximiliano Paolucci, and we spoke about the contribution and investment of the World Bank in systemic solutions in the country. Our great supporter, even in the time of the greatest health crisis, the COVID-19 pandemic, was the World Bank, and I would like to address this issue. Thank you. You may take the floor.
And thanks again for the question. I will, in going through and detailing what we supported through this project, I wanted to mention again one important point. COVID-19 has taught us the importance of being ready and get prepared to face yet the next crisis. Unfortunately, we live in times of crisis, and we cannot prevent, or we cannot anticipate when this crisis will come. But a country's response is as good as the preparedness system that this country relies on is strong. And one of the most important results of this project that is just concluded, just finalized, is hopefully to endow the country with the systems and with the also the thinking that would allow the country and the health system of this country to respond to the next crisis. Now, this project had two objectives. The first objective was to basically keep people alive during the crisis. And the second objective was to help people to basically bring something to the table every night. So there were two components of this project. The first component, let me start from the last one, was basically to provide additional resources, additional payments through the GMI, so through the guaranteed income scheme of the country, to especially targeting those that could not go to work, or those companies that separately was another scheme that could not stay open or face difficulties staying open. So that's through the support provided through the GMI scheme, we reached out almost 30,000 people in August 2020, and this number went up to almost 36,000 in November 2020. But the assistance continued, and also in the last 3 months there were payments in the amount of 1,000 Macedonian denars that were provided to selected recipients identified through this scheme to weather the consequences of the increase of prices of food and energy. So there, the main lessons learned is that this system, the GMI, worked well, helped identify people that needed this support the most, and helped identify also, now that there is another crisis, who needed additional support to face the consequences of inflation. Now, the second element of this project is the clinical one, if you wish. And through this project, we not only provided immediate assistance to strengthen COVID response by strengthening, for example, the intensive care units. We equipped 678 intensive care unit beds for COVID-19 patients. We provided isolation capacities. We contribute to also implementing the vaccination campaign, which is extremely important. So, and with that, the recovery rate from COVID reached 97%, 97.22 to be more precise, which is impressive. So but the other element of the health component of this project is, again, as we saw in the social protection one, was to work at systems to detect when a crisis is emerging, and systems to react immediately when the crisis has erupted. So we hope that by also working with the Ministry of Health, as the Minister elaborated before, by providing all the machinery, but also the thinking behind a management of a crisis, we hope that the country will be better prepared for the future. And definitely, this has not been easy. As you know, this has been a very difficult and challenging epidemic that has tested the health system and the social protection system of the country very much. But we see that the response has been, at the end of this project, has been quite positive. So we are now in the process of learning and looking at the results of this project and drawing lessons learned, which we hope will be useful to the country as they plan for additional interventions in this area. Thank you very much.
Thank you. The social protection system and the health care system must respond quickly in crisis conditions, and they were tested in the conditions of the COVID pandemic, certainly supported by the World Bank and the United Nations organizations. Systemic solutions to improve health services for all citizens, then support for the system of international classification of functioning, supported by the international organizations and other activities in the area of health care, where the UN has provided support, and we'll hear about this by Ms. Rosana Dudziak, and the system itself and its introduction of the international classification of functioning generated the replacement of the medical model with the social model, and we should start as early as possible, not to lose the very significant period of early child age from the very birth, to start monitoring children born with risk factors and developmental difficulties in order to prepare them as well as possible to get in the system of early child inclusion and early education. We are ahead of a period of opening all regional centers such that every child can be assessed in their local environment and in the social context in natural environments where the child operates itself. So within these 4 years, you have your 4 minutes.
The UN is happy to be supporting the development and introduction of the system of functional assessment of children with disabilities and developmental delays based on the International Classification of Functioning, and this will be a single entry point for children and youth to access various support services in the fields of health, education, and social protection. This is no longer purely a medical assessment, but a rights-based approach to disabilities. 2 bodies for functional assessment covering the Skopje region have been created, and the establishment of bodies for functional assessment will complete the introduction of the new model. And again, this will help children with disabilities have a single entry point for support. In parallel, the amendment to the law on healthcare has been adopted in Parliament, which ensured the legal basis for sustainable functioning of the service with the national and 10 functional regional assessment bodies for children and youth. Work was also undertaken to assure alignment of the policies within the 3 line ministries: health, education, and labor and social policy, as well as with other relevant institutions. The ICF model has to be strengthened to not only be a health approach. However, the UN has also been working to support the healthcare sector, and this was before, during, and after the pandemic. First and foremost, several UN entities have been working with the Ministry of Health on the very important health reforms, focusing on improving conditions and coordination between providers of primary care, and as Minister Saleh already mentioned, enhancing digital healthcare services. The UN has also worked with the ministry in strengthening the overall immunization system and social campaigns and targeting improvement of interpersonal communication skills and the capacity of frontline healthcare workers to address vaccine hesitancy. The COVID-19 pandemic further deteriorated access to sexual and reproductive health services for women and girls living in underserved and remote areas, previously caused by an uneven distribution of gynecologists. We are particularly happy that the model for the provision of a range of sexual and reproductive health services through mobile gynecological clinics was fully integrated into the national e-health system and provided assistance to more than 2,000 women in over 20 different locations in 2022. Significant progress has also been made on the quality of maternal and newborn health, as was previously mentioned, and this is embedded in the National Master Plan on Perinatal Care. To leverage these achievements in the period to come, it will be really important to focus on developing a health workforce strategy and a national patient safety plan. The barriers to health services in rural and remote areas and small urban settlements must be assessed in order to address health inequities and contribute to social cohesion and resilience in the country's interior. This is only a small part of the work in this area which we will continue in the future. As always, the UN family stands ready to work with the government and all national and international partners to contribute to improved quality of life. Thank you.
Thank you. Now we'll return to the last panelist. This day is quite long, but I hope that we'll keep your attention for the last address of Madam Stanka Trajkova, representative of the pensioners. In her last 4 minutes, she will speak of the social policies related to the pensioners. You may take the floor. We know that the basic social and material safety for the pensioners is provided through the pension, and at the satisfaction of the pensioners in the past period, we had regular payment of the pensions. However, very important are the measures beyond the pension system. As we heard, the social policies that are being undertaken in other areas of living. A positive circumstance was the fact that the anti-crisis measures in these conditions of overlapping crisis, demographic, economic, and energy, pensioners were included, especially those who have lower pensions. This was a great effort of the Minister of Labor and Social Policy, and it is good to express my appreciation because these inputs reach the Union of Associations of Pensioners. Dear attendees, I was impressed by the title of 2023. This should be a year of opportunities. So we, the pensioners, as aging population and an enormous target group, we expect that, and here we have the Minister of Health, of course, the positive list of medicines will be adopted because it is very important for the pensioners and for the other citizens. Also, we expect that efforts will be invested for simultaneous functioning of mobile pharmacy and mobile doctor units, especially in rural areas, because we know the conditions there when many of the children migrate and elderly remain alone. So if only a mobile doctor's unit comes and there is no mobile pharmacy unit, then the elderly should go to the town or should have someone who will do this for them. Of course, we also hope that in 2023 we will increase the limit. Those with lower pensions are exempt from hospital participation and healthcare services participation. Of course, this will be in the focus of the Ministry of Health in cooperation with the Ministry of Labor. We should resolve the issue of deficit of homes for elderly people. I should mention that pensioners ask, and it is very normal and justified, construction of national homes for elderly, although there are many private ones. However, the price of the services in these private homes is quite high and is not compatible to the pensions of our pensioners. So the union and the pensioners support the measures such as social services for the pensioners at home because it is good for these people to be closer to home, to their chairs, to their street, to their neighborhood. But there comes a time when they should be accommodated in an appropriate institution for elderly people where the approach and care is quite different. Regarding the question in the first part of this panel, it was how pensioners live today, how they organize themselves. The very fact that the organization includes about 280,000 pensioners, and this functions for more than 75 years, it speaks that this form of pensioner organizing is very significant and quite needed, and it is good that these civic organizations and the union have support in their operation, and they can present their views and opinions and to impact the policies and the laws that are related to them. Since we have many young people here, I would like to say that when these young people will be older and right before retirement and will feel that they're less worthwhile, and on the other hand, what are we going to do when we'll retire? There will be a lot of free time for family obligations and functions. And here we have the associations of pensioners where the pensioners can join and be part of activities. And dear attendees, the pensioners, the future pensioners, are not retiring from the society, but they elected a life and future during their retirement. There is an opportunity for all the activities and work that pensioners could not do during their career and while they provided for their families. Now, as retirees, they will have a lot of free time where they will be able to accomplish the goals that could not have been accomplished previously. That is why I believe that when speaking of conditions for such retirement, yes, there will be, if the pensioners are satisfied with the pension system and all the other policies that need to be undertaken in the other areas. Let me not go more than this for a lot of minutes. The questions and answers, a lot of questions and answers for the pensioners. We can speak a lot, but we should resolve this together, mostly with the Ministry of Labor and Social Policy, to reactivate these requests, to repeat them, not because we are older and we are forgetful, but for the purpose of these questions and requirements to reach the entities who should resolve them. Thank you. Thank you for pointing out the benefits and the expectations of our citizens. However, thank you for thanking for the benefits, because this shows great maturity. This was the last panel for today. Representatives from the executive power, civic organization, economic community, international organizations, and World Bank, all stakeholders who can give their contribution to the screening process through the pre-accession period can give their maximum so that we can show that by 2030 we will be a member of the European Union, and something that is related to the same year, the 2030 agenda, so that we can all say that we gave our contribution for all citizens in the country and we did not leave anyone behind. This completes the last panel for today. Tomorrow we'll continue with the work part with the 4 new panels at the agenda. Goodbye. Dear attendees, this panel concludes the first day of the conference Year of New Opportunities. We expect to see you tomorrow on the same place at the same time. Thank you.